Welcome back to Good Morning San Diego. Enhancing your summer beach body. Yes, Dr. Melanie Palm is here to show us some of the latest non-invasive treatments. Now, I typically think that you are just doing sit-ups, but there are more things that you can do. Talk to me a little bit about this.
Yeah, so we actually wanted to show you a few devices and remain fair and balanced because the industry is really exploding. So we actually have our lovely model, and she's kind of had a mommy makeover in the past. We actually have before and afters of her tummy. What we're demonstrating right now is one of the fat reduction techniques that's used. So many of you may be familiar with cool sculpting. That's what we use to actually freeze fat, and cycles typically reduce about 15 to 20% of fat. In this instance, we're heating fat. So we're using something called field radio frequency to be able to treat not only the abdomen but the flanks at the same time with this Vanquish ME device. So, you know, in cosmetics and in dermatology, there's so many things that we can do non-invasively, and we've been able to go down as far as fat. We've never been able to treat muscle non-surgically. So the device that's actually at the head of our examination table is called ImSculpt, and this is a completely new class of devices. There's actually going to be another one debuting at the end of the year, but this is the first and the foremost. It's had 7 clinical studies, including imaging studies like ultrasound, CT studies, showing that you get an increase in about 16% of muscle mass, and when you treat the abdomen, you actually lose fat as well. So lose about 11% to 19% of fat, depending on what area that we're treating and how many treatments. It does not hurt. It basically, during a session, and we do sessions twice a week for a total of 2 weeks, so 4 sessions. And it feels like a supraphysiologic contraction, like you're doing about 20,000 abs during a treatment.
Oh, great, so you're going to be sore.
I know. Or you can do the bottom, and it's like doing 20,000 squats. And why I think that's important is because there are risks with surgery. So in the news, there have been fatalities from these Brazilian butt lifts. And women in San Diego, they want an athletic look. We know our little buttock drops, so it's nice to be able to talk about something non-surgically that actually lifts the buttocks. We're actually one of the clinical sites for doing a study where we're looking at MRI studies before and after treatment and seeing a visible change in patients as well. So the nice thing is we can start with fat, but now we're truly entering an anti-aging period where we're rebuilding muscle. We lose about 10% of our muscle mass starting at age 30 every single decade. So I tell patients I've done it to my core because I'm up standing all day, and my tendency is to lean over patients. So if I have something that gives me a strong core, it changes my posture, it helps my abdominal muscles. It's truly something that functionally improves my quality of life.
Okay, so who is this good for? How do you know if you're a good candidate for this? Because maybe you don't fit the criteria, or maybe you do.
So, as with other cosmetic procedures, this isn't an excuse to not have good diet and exercise. So someone who's relatively close to their sort of ideal or plateaued weight, they need to have a healthy exercise regimen, healthy diet, and they just have areas that they need to pinch some fat away. That's where these either freezing the fat, heating the fat, I think is helpful. And then in terms of muscle movement, I think that helps a lot of different patients. People that are in the gym, have abs, but just really want to get more definition, it provides amazing definition for that. For women that have had children that get spreading of their abdominal muscles called diastasis recti, we've actually shown in clinical studies it helps reduce that width.
Is this happening right now?
It is. So this is actually the fat reduction. When
you feel it? She's all yes. Yes, her eyes get really wide. So it is working right now. So anybody who's looking to lose that specific area, target it, non-invasive way, you're still going to have to diet, you're still going to have to exercise, but this might be able to help.
So a little added punch.
Okay, well, thank you very much, Dr. Melanie, for coming in and telling us about it. We're going to have more Good Morning San Diego coming back after this.